This podcast is sponsored by Orchid Live. Orchid Live is a specialist occupational health software used by a number of SOM members to run every aspect of their occupational health operations. They hold healthcare records for over 1 million UK workers and work with both in-house OH teams and OH providers. You can find out more at orchidlive.com. Hello and welcome to the SOM Podcast. I'm Steve Randall, and this episode is one of a monthly series to help you as an occupational health professional with your CPD, as we invite specialists to share an overview of some of the topics you've told us you'd like to find out more about.
Hello, my name's Amy McKeown. I've been working in and around workplace health and mental health for 20 years now, ranging from being a health provider of a mental health tech startup in the 2000s, being in-house as a corporate, putting in one of the first UK health and mental health strategies, and then for the last 7 years as a consultant, where I've put in workplace health and mental health strategies from global organisations such as Burberry and Samsung to the EU Parliament to SMEs and other smaller organisations. So a whole range of different aspects of workplace health and mental health.
Well, Amy, welcome. People who listen to this podcast regularly will have heard your voice already on various episodes, but we haven't done one, which is in a way surprising, as a mini CPD episode on just what good occupational health and wellbeing looks like in a modern organisation, which sort of really cuts to the core of most of our listeners' everyday lives. So what for you needs to be there? What are the things that would indicate to you that there's a good occupational health and wellbeing structure in a modern organisation?
Well, that's a really good question, Steve. I mean, I'll start with the fact that number one is to have one. In that a lot of organisations in the UK, and especially SMEs and smaller ones, don't have any occupational health or wellbeing. So point one is to have something in place to support the health and mental health of your employees. The gold standard is a multidisciplinary strategic approach to workplace health and mental health that covers prevention, early stage of illness, and then absence and rehabilitation. And obviously there's a role for occupational health in all of that. But in answer to your question, to have someone to have designed a structure that is going to work for you and your organisation and your culture. I mean, I've worked with a huge range of different organisations in different cultures, different industries and different environments. And it's about putting some thought into what you're delivering.
Yeah, so you can't just take an off-the-shelf thing. You can't just read an article and look at a couple of studies and think, oh yeah, that'll work for us. You need to tailor it to your organisation to really understand the challenges and the needs of the workforce and the business, of course, when implementing this.
Absolutely. And one of the biggest things I've seen in my career is the lack of good occupational health provision, or where there is provision in place, not using it properly. I once worked for a corporate where we had 14,000 people across the UK, mainly on client sites, so travelling around. And our occupational health provision was 2 occupational health nurses sat in the basement of a London office. So, we're at a point now with health and health delivery where we've got so many options. So firstly, it's about procuring the right occupational health for you and for your organisation. So we replaced the 2 nurses in a basement in London with a dedicated triage nurse. So HR referred all people who were ill to this person, who then triaged out to all of our other health providers, but that understood our industry. And most of our occupational health was done by virtual appointments. So we had a nurse triaging out, and if you needed to see an occupational health physician, we had a service level agreement that person was seen within 24 hours, either virtually or in a local office. So that's a really good example, I think, of moving away from 2 people in a basement in London to to a virtual service with SLAs that was procured properly that could support 14,000 people across the UK.
That's really interesting, because you might think, oh yeah, the more people we've got on this and having it, as people in a dedicated office, that's the way forward. But actually, it's about being smarter with how all this works to make sure that it's the right fit for the organisation.
Absolutely. And looking at how contracts are procured. So I've worked with a number of organisations where your occupational health is a volume business. You're selling clinical time at volume, where actually the contract, occupational health providers tend to procure through retainers, but then paid for reports. So if you're doing a paid for report model, then obviously there's less incentive for the organisation to use the occupational health provider, because every time they use it, they're paying for a report. So it's also how you structure not just delivery of healthcare, but how the commercial model underpins it as well.
And a lot of companies like to jump on board with initiatives, and that's always a word that you've got to dig a bit deeper when somebody announces they're doing an initiative, because it could be something they're just doing for a day or a week or a month. It could be longer term. But how can companies move from, just offering one-off wellbeing initiatives to actually doing something more sustainable, more long-term as a proper strategy?
Well, you just said the word yourself there. It's a structured strategy. Right? And occupational health might not own the strategy, but they're certainly a key stakeholder in it. So when I work with organisations, we look across the board at kind of what we are doing to prevent illness. So some of the ways that occupational health can get involved in that is, looking at what cases that they're seeing, and then working with the organisation to develop prevention for the sorts of cases that occupational health is seeing. There's a huge amount of knowledge in the caseload that is often not used. But things like pre-employment questionnaires, assessing risk in the workplace, doing health surveillance, feeding back in, as I said, caseload information into prevention and education and awareness. But also I was working last week with people who were in safety critical industries, and things that occupational health does about noise reduction, dust reduction, vibration reduction, that can be part of a preventative end-to-end strategy. So occupational health can get involved looking at initiatives for prevention and how they fit. Then what we do when there's early signs of illness, who does what, who refers to who, how HR and the line manager interact with occupational health. And then how occupational health is used to manage sickness, to create reasonable adjustments and other things like that. So there's a huge number of ways across that spectrum of prevention, early stage treatment and illness and rehabilitation that occupational health can be involved and should be involved.
Do you think that a lot of organisations see occupational health and their wellbeing initiatives, wellbeing strategies, too much about absence and return to work and not enough about that prevention piece?
I think it's changing. I think, if I'm going to be blunt, and I'm aware that this is a SOM podcast, is that I think the biggest challenge, for occupational health is that most organisations I've worked with either don't understand what it is or how to use it properly, or aren't using it properly. So I've worked with organisations that have wellbeing strategies, but then have occupational health not included in the wellbeing strategy. In fact, last year I judged a number of awards where I'd look at wellbeing strategies that didn't talk about psychosocial risk and had no mention of occupational health. So I think stage one is for organisations to recognise what workplace health and mental health is and where occupational health fits and where wellbeing fits in that. Because obviously wellbeing is part of that, and then to go across the spectrum. And because if you're looking at it through the lens of occupational health, which is caseloads and clinical care, then it's really easy to miss the prevention bit. If you speak to people who aren't involved at all in occupational health, I think they think that occupational health is something that's only on an individual basis. It's at an individual level, not at an organisational level. So, if somebody needs occupational health, somebody's brought in to help with that. But at an organisational level, perhaps people don't understand what it can do. Massively. Occupational health, sadly, still has the reputation in many places that, you bring in occupational health to write a report when someone's been off sick for a long time to help, the organisation either get rid of them or figure it out. It's much, much further down an absence in many cases. Whereas actually they are key in prevention. And often you can get a really good return on investment of occupational health through the use of reasonable adjustment. So actually, instead of it being when someone's been off sick and you're writing a report, it's actually you can prevent that absence by somebody being intervened with earlier and reasonable adjustments that can be managed at work so they don't have that absence in the first place.
And I imagine that once they've got a number of opportunities to see what occupational health can do and look at that return on investment, look at the data, they can then measure the real impact of OH initiatives and see how it might actually help the long-term business situation, because they won't face, hopefully, the same problems over and over again.
Absolutely. I think if used properly, occupational health can be one of the areas of health, mental health and wellness that is easiest to show an ROI on. It's just that sometimes it's not seen as sexy, whereas a flashy wellbeing initiative that is promising the earth can be. Whereas actually, if you stick to, you need well people in the office working or in a workplace working to maintain a productive company, and you keep it at that level, then, and you look at occupational health and how that can contribute, then yes, you can get an ROI much more easily.
And let's end on a positive. What trends do you see shaping the future of workplace health and wellbeing over the next few years?
Oh, well, that is exciting and it is a positive. I mean, we've talked a lot and I know that you've done a lot of podcasts on Keep Britain Working, but for me, whatever happens with that, it was really encouraging to see the strategic, multidisciplinary approach to workplace health and mental health that I've done for a long time now being really central to government policy, and that landscape of employer, employee and government shaping something. So we're talking more, the language is changing to strategic multidisciplinary workplace health, workplace mental health, presenteeism, how to make work good and how to manage absence. So actually, I think we're really at a point which is ripe for innovation. And in fact, many of the conversations I've been having offline with different people is that people can see a huge opportunity here for doing something different around not just workplace health and mental health, but health and mental health in the UK. That's a different relationship between government, employers, employees, and providers. So actually, I'm always a half full girl anyway. But actually, I think we're at a really exciting time that's ripe for innovation. We just need to keep going and deliver on that and make sure that we're having inclusive, collaborative conversations and that we're really innovating. Moving away from old models of how healthcare has traditionally been delivered and how that applies to the workplace, but are really ripe for strategic creative innovation.
Well, I asked to end on a positive and you certainly delivered, Amy. Thank you so much for that. Where can people find out more about you and the work that you do?
Well, I have a website, amymckeown.com, and I am on LinkedIn. I write a lot there. I have a great newsletter. Well, I think it's great, where I write about industry trends and workplace health and mental health and change, because I'm doing a lot of work in change, and through SOM, who I'm delighted to work with.
Fantastic. Well, thanks for being on the SOM podcast.
Thank you very much for having me.
This podcast is sponsored by Orchid Live. Orchid Live is a specialist occupational health software used by a number of SOM members to run every aspect of their occupational health operations. They hold healthcare records for over 1 million UK workers and work with both in-house OH teams and OH providers. You can find out more at orchidlive.com.